ostrich.
MZTV.
Hello, sorry, Dan just blurted out the word ostrich before we went live, and it's totally thrown me off. Welcome to the latest episode number 6 of Disability Horizons TV, and this one has been called Doctor and subtitled it. Everyone keeps ignoring me. Next, please. And it's about our experiences with doctors, both wonderful and not so wonderful. And tonight we are joined by, I should think, a wonderful doctor. We'll talk about Mick in a minute. First of all, let's say hello to the gang.
Oh, hello. I was going to say, now you see, if I was your doctor, that would be scary. Right? Even I know that would be scary. I'd probably be very good, but only at certain things. So I'll just say hello, everybody, and try to get the picture of me being your doctor out of your mind, because it must be horrific.
And talking to doctors, is Doctor Who?
No, yeah, but the thing is, you pronounce it right. As I've been told, it's not doctor, it's doctor.
Doctor.
So it's supposed to be doctor. But anyway, yes, hi guys. As you know, I could be anyone's doctor. This is my normal hand. This is my surgery hand. Yes, look at that. Bloodletting, leeches, anything. Go for it.
And our guest tonight is Grace Spence Green, who I'm going to admit that I hadn't seen you on Twitter or anything, but when I saw your story that I was sent the link to in The Guardian, I remembered the story. So it is the one and only Miss Grace Spence Green. I'm looking at that because I've got a terrible memory. You're a fourth-year medical student?
No, I'm actually... Oh, it's so weird to say still. I'm a doctor now. I've just graduated.
Congratulations.
A doctor. But she's also one of the gang. Grace is a wheelchair user.
Woohoo!
So welcome to Disability Horizons. So where do you work, Grace? What hospital are you at?
So I will be starting at St Thomas's, next week. Not this
Blimey.
Monday. Yeah,
Wow.
very scary. But so lovely to be here. Thank you for having me.
Scary.
Absolute pleasure. Thrown at the deep end then. If you graduated, go to work.
Yes, off you go. It's not going to be scary at all. There you go.
Yeah. Nothing wrong with the deep end.
So, Grace, I mean, your journey into a doctor, I mean, is this post-spinal cord injury, or had you already started the journey?
So I was actually in 4th year of medicine in 2018 when I sustained a spinal cord injury, and I was in hospital for 3 months, took a year out, and then jumped back in, and then did my last 2 years as a wheelchair user. And then I'm going to be a doctor in a wheelchair, which is in both parts exciting and a bit nerve-wracking.
And how do people react to that?
Yeah, it's interesting. When I had my spinal cord injury, the first thing I said basically when I woke up from my operation was, can I still be a doctor? Because it was sort of, it's my passion, and it's something that I'm so grateful for, because it's something pre-injury that was so part of my identity, and I could hold on to that. So that was really, really good. So as soon as I knew I was going back, that was really good motivation to get through hospital. But I had all my professors tell me, yeah, don't worry, we'll sort it out, you'll be fine. But I'd never seen a doctor in a wheelchair, so I really didn't really believe any of these able-bodied people telling me I could practice. So it was only when I started looking at some finding. I mean, I have to collect them like Pokemon cards. There's so few of us. But as soon as I found doctors that were practicing and they were in wheelchairs and doing great things, that's when I really was like, yeah, I can do this. And so it was really exciting. But the reception has been mixed, of course, as I'm sure all wheelchair users know, that society's view of us is up and down. So some people have been really great. Patients have been brilliant to me so far as a medical student. I found I think because a wheelchair is such a visible scar, they instantly know that I've been through something. I must have been an inpatient at some point. So I just feel like they're a bit more honest with me and open, which I really appreciate. I think that the tricky thing for me has mostly been colleagues and kind of other people in the hospital, is trying to prove to people that, I can do the things I want and I can function as a doctor. Because I think the bar is so low for disabled people that they're not used to seeing us in roles of caring for other people, as you guys must know. So, yeah, it's been a challenge, and it still is. And I'm quite, apprehensive to go in as a doctor and face that.
Well, it'll be good to get your insights into the other side as there's a bit of a peek in. What's it like, kind of thing. And at this point,
you're our Trojan horse.
Before we ask our presenters their stories, I'm going to pop this up. Yeah, the person laughing the most is the person we probably need to put that up for.
Yeah, we are going to talk tattooed on my forehead.
Yeah. We are going to talk about the good and the bad experiences, and I think, like many, I've had a lot of negative experiences from being overdosed on fentanyl. I ended up in A&E, and then when I can say to the consultant, "Hey, this happened," they're like, "Yeah, you don't need to see me anymore. You're discharged." To be in hospital with ECG changes. Is it an ECG? ECG changes and all stuff like that, negative T waves. And they're saying, "Oh, you're very unwell," and rushing me all over into London, to then walking in and saying, "No, your problem's above the neck, not below. Get out my hospital." And so I think for a lot of disabled people, this is the problem, isn't it? It's the disbelief. I mean, it's all right, if you've got something horrific, if you get run over by a train, you lose your legs, God forbid, or something like that, then there's not a consultant in the world, I would hope, that would say, "I don't believe you." But for many of us that fall between the cracks, it's a minefield. And so we've got Mick here with his stories Mick's stories. Please go gentle on us for his physical disabilities. And then we'll have the other side.
And tell me my stories. Yeah, I know.
From that. So come on, Mick. Give us a couple of your classic stories.
It's tricky for me because if I'm honest, I mean, I've been disabled since birth. I was born with cancer, like I always say. And most people that view this now know my story off by heart. And so I can honestly count the number of doctors who I would say had done things right on one hand. And I'm not entirely sure I need all the fingers. Do you know what I mean?
That's your left hand.
So it's I have one hand. Anyway, so I think that you know what I mean, so if we're trying to be good and bad, let's do the good first. I was very fortunate after I was born with cancer that I was given to a wonderful professor called L.G. Capra, who
what a name!
He's a superstar. He really was. And he basically treated me for a cancer that up until then was pretty much incurable. I was stage 4. It was big. I mean, it was the size of my fist in a baby. I don't know how big babies are, about that big, I think. Anyway, so it was quite big. And it was only when it came out of my body that it was spotted. So all the birth checks didn't notice that my right leg was paralyzed and I had a tumor inside me the size of a small tennis, size of a tennis ball or bigger. But anyway, he did loads of stuff. He cured me. He was amazing. I have had surgery by another couple of surgeons who were amazing and who rebuilt me and saved my life, basically. So what I tend to get surgeons that do it brilliantly when it's life or death. But the bit before that tends to be a bit of a disaster. And I tend to end up in a situation where I'm in the life or death situation because someone didn't spot something when it wasn't life or death. So that's been my life story. I mean, the perfect example is in 1999, I had a car accident and broke my back again. And no one spotted it because I was already paralyzed. So for 4 years, I just got iller and iller, and the pain got worse and worse, and things stopped working, and everything was weird. And it was eventually I was, I went in to see someone, said, "I'm in agony, what can we do about it?" And the answer was, "Well, we could sever your spinal cord entirely and that might stop the pain." And it was like, "Yeah, but it will stop everything else, wouldn't it?" I went, "Oh yes, but is your pain really that bad then? Is that the answer? Total paralysis from the chest down for someone that's got an impartial break. I've got an incomplete break, so I got a lot of function."
This is the problem, isn't it, Mick? Yeah. When we're already unwell, when we're disabled or got chronic health, doctors just go, "Yeah, it's that."
You do get a lot of people, I think it's the same experience, and this is why it's so wonderful that we have Grace coming on our side. It's that we go to see people, and they always think it must be because of what you've got. And you don't always get anyone go, but that's not part of what you've got. So let's look at it further. So you end up with a situation where something new comes along that's not actually to do with the fact you're disabled, but they just go, well, it's part of it. And so then it gets really bad. And then you have to have loads of stuff done. And then that adds to more of the stuff you can't do normally. And so it's sort of a vicious kind of circle like that. But yeah, I mean, I've mostly had people not believe me. I recently had a doctor do surgery on me against my wishes. I had not given him permission. I did not need the surgery, and it said so in my notes. But because he didn't bother reading them and instead just went, I'm a doctor, I know everything. You're paralyzed, so I know this doesn't work. And it took me 8 days to fight to get him to reverse the surgery. In the end, he wouldn't do it. He got a junior to do it because apparently he didn't make mistakes. And that was the kind of thing. I've had that all my life. I found out when I was 15 and had my spine collapse and, went in the chair. They said to me, if you try hard enough, you might be able to walk again. So I spent 3 years trying, and I failed. And I was like, oh, well, I obviously am not going to do this. I've obviously failed at this. And then about 3 or 4 years later, I was just sitting bored in the hospital waiting to be x-rayed and found my notes. And I was looking through my notes. And in the back of my notes, in a little envelope, folded up into a tiny little square, was this bit of paper. I opened it up. And it was the review of my first surgery when I was 15, including the famous line, unfortunately, during dissection of the muscle group, we severed the L1 nerve junction. So that leg would never have worked. And instead of saying, yeah, no, you're paralyzed, mate, they just, because it would mean that they'd have to admit they'd made a mistake. So I'm not a big, I don't sing the praises. I tend to watch Super Vet and think, I wonder if I could buy a fursuit, because that's the kind of person I want treating me. But I've not had that many of that. I have a Super Vet spine, but that's something else.
I have found that when I go for an outpatient appointment, the consultants aren't nearly as good as when you suddenly go in and you see somebody you've never seen before. What's the word for the doctors? Not a junior doctor. What do they call them?
Come on, Grace. What's the junior?
Lower than a consultant. Lower.
Like registrar,
registrar, someone like that. Those are the ones that are the most keen and really, really keen to try and figure something out and go, right, no, this isn't good enough. They've still got that freshness to them, haven't they? I mean, Dan sits astride 2 points. I mean, Dan, as well as myself, mental health issues, but also as the father of somebody who is disabled. Yeah. This must be very frustrating.
Well, it's because Emily comes under pediatrics. I understand that's what you're doing, Grace. Is it pediatrics you're doing?
That's the dream. Yeah, that's
the dream. Because our experience, obviously, with Emily's care has been nothing but exemplary since the word go. I mean, the relationship she's built up with everyone at that hospital, surgeons, anaesthetists, the play leader. They're talking about Southampton General here, is to the point now that she is just a family friend when she goes in. So there's never been anything really negative, obviously, from the first diagnosis when we're all taken aback on that first day. But other than that, the care she's received and the care we've received has been above and beyond. I mean, I could honestly say that everyone there is completely and utterly cared for her. I mean, it's coming up to a year's anniversary since her scoliosis operation.
Wow, already?
Yeah, and when she was in, because she was in during the first lockdown, my heart just absolutely bled for all these nurses and physicians and doctors running around that hospital, because they weren't even allowed fans on their desk because of the way it would blow the air and blow the spores through the air. So they weren't even allowed that. And they were short-staffed, but they did not fail one instance in making her feel cared for, valued, happy, and keeping her laughing. So from Emily's POV, I would say the NHS has been absolutely incredible. Every doctor was incredible. They don't talk down to her. They talk to her. They don't talk to us. They talk to her. I mean, obviously, before she could speak, it was a case of talking to us. But no, they've learnt the empathetic link between physician and child, and they talk to her on a one-to-one. They even get her PDA autism, which is blown my mind, because there's so many people out there in a big wide world who think they still have to speak to her like that, like these people are in a Carry On film when they're trying to speak to the Spanish waiter. Do you do chips, mate? No, it doesn't work like that. But it's all, I mean, it's been learning curve from both sides, learning curve for Emily, learning curve from the doctors. But yeah, as far as Emily's concerned, it's just been really, really, really good care. And when I see how short-staffed the NHS is, and when I see the pressure that they're under day in, day out in the paediatrics units, I just want to walk up to number 10 and just kick his door in and just drag him by his words, will gummy chair down it.
There you go.
What?
Yes. No,
Yes, thank you.
Sorry, Dan took me unawares there. I just really wasn't expecting. I mean, yeah, I've seen it on the TV. People say, it's great, this paediatric care. It's when they then go up that sometimes it can take off. I mean, Grace, you're seeing it from both sides. So how have you found your medical care with having medical knowledge? Has it been a strange...
Yeah, I think it was really shocking because, at the start of the week before I was injured, I was going in as a fourth-year medical student. Hospital was really quite a nice place for me to be, good learning environment, etc. And then I woke up and I was suddenly on the other side of the bed, and suddenly it was terrifying, and I felt so vulnerable, and I didn't trust a lot of people, and it was really, a humbling experience those 3 months. I really was really surprised by how little autonomy I had at times, how little dignity I felt like I had a lot of the time. I think, Mick, you touched on it, but I think consent can be a real issue. Where I would be consented for something, but you need to have consent, every step of the way. And I think that was sometimes lost. I felt like a lot of conversations about my care were happening at the end of the bed and weren't involving me. And like basic things, like 8 people would come into my room and they wouldn't introduce themselves. And I think I was a bit of a terror on the ward because I started getting really rude, and I'd demand to know every single person's name and what their job was and their title, etc. Because it was horrible to me. And knowing as a medical student that they all had access to my notes and could see what happened or whatever, and that they'd know all about what happened, but wouldn't even tell me their own name, was just awful. So yeah, it was a really big experience, and I think you guys all touched on some really interesting issues. Dan, the fact that I think pediatric care, from what I've seen, can be really excellent, but as soon as they leave that, there can be real issues. I know a lot of people in the spina bifida community find that the care as kids is amazing, and then as soon as they're 18, it drops off. But yeah, it really surprised me, and I think now as a medical student, I think a lot of doctors, I don't think it comes from a malicious intent, but there's a big ignorance. There's a real lack of awareness of disabled people's lived experience. And because of that, I think there's such a bias on the quality of life of disabled people. And I think that's just one of the key issues, because if someone doesn't think I have a good quality of life already, why would they really give me the right treatment options or good care?
Do you know what, Grace? That's it's funny. I see the same spinal specialist every year for a catch up and a revise of what's going on, make sure it's all still in the same place. And every year I talk about my life, and every year he goes, "You seem to be so happy. I'm so glad. I don't meet many happy people in your position." And I'm like, but this is a spinal. So does that mean that every other patient you have is just not being treated properly, and you're not really? Why am I?
Or is this just his spiel? Is this just his trying to?
I don't know, but it terrifies me, because I mean I've had a DNR on my notes when I was young. I was one of the first reporters at the BBC to report on DNRs being put on disabled people's notes without them asking. And it's been, I mean, this is in the early 90s, so this is a long while ago. It's been going on. And there is this idea. Yeah, I know. It was all, all the old things. There's only 4 channels. And it's true, there was. So the idea that our lives, we don't have the same quality of life. And I think that's really concerning. And it's why it's so wonderful to see this new generation. I mean, Sally, one of our wonderful viewers, has just said that her daughter is a wheelchair user. She's got EDS, and she's being encouraged by our consultant to go into medicine. This is great, because the last time I was in, for the first time ever, I had a wheelchair using psychologist come and see me. And we had this instant bond. We talked about stuff, and she went, "I know exactly what you mean." And I'm 56 this year, so I've had 55 years of doctors coming in and talking to me, and this was the first person in the medical profession that got it straight away. We had a bond, and I cannot imagine the feeling of wheeling into a consultant's office and the person that greets me is also disabled and going, yeah. It doesn't even have to be the same thing. It can be any impairment. I don't care. Just the idea, I know what it's like to have my life judged less because one of the big problems is we are kind of like, it's like going to a car mechanic and they only deal with Ferraris, and then you wheel in and you're some clapped out little mini. Do you know what I mean? You know, or even worse, a lot of us are like something made by the Mutoid Waste Company, in that we're all bolted together wrong, but we kind of work a bit. And they're like, oh, well, you know, I only deal with Ferraris. I don't know how to deal with you. And you're like, I like being a crappy, broken down sort of classic that's held together with tape. And, you know, so the idea of knowing that the future is going to be more and more, we're going to be represented in the medical profession is just going to be amazing.
Yeah, this is why I'm really passionate about getting more disabled people, you know, into medical school, into healthcare roles, because I think a lot of young adults I've spoken to that are disabled just say they've never seen anyone like them. They've been told by someone that they can't do that, and because they haven't seen anyone, they just don't think it's possible. And I think it's really difficult for a disabled person to get into medical school. Basically, I think all of the doctors I know that are in wheelchairs were injured during their degree.
I see. Yeah,
it's really hard, and I think that needs to change. But it's such a big issue that it's.
Well, yeah, it's so important
doesn't it?
That link, that bond. But like Mick was saying about these doctors that expect us to fix it, my big problem has been orthopedic doctors over the rest, apart from pain clinic, because I think they're the fixers of the doctor world. And you've got a lot of, in America, they call them the jocks. You know, you got the orthopedics, how we do it's all big, tough work. And, you know, we bolt things together. And they really just want to fix. And I've said this before, my orthopedic surgeons couldn't handle it once I'd had this osteochondrital graft where they took the knee apart and drilled out from various places, and I recovered from that through to all these different surgeries and then a knee replacement, and then saying to me, it doesn't hurt. You have a metal knee. It cannot hurt. It's metal.
I
said, no,
it's not attached to anything.
I've been to medical school, but I think I've got muscle and nerves and skin around this, down to fighting them for amputation. As you know, I caused myself massive problems. Ended up seeing a psychiatrist because I said I'd do it myself. But, you know, I think we just grow tired. And one thing I want to talk about is taking back control of your health, of your medical needs. So I've come away from hospitals because I became a patient. And a lot of people can get caught in that, where we're constantly chasing. I haven't got a firm diagnosis on anything. They've all said it could be all these little bits. And you chase all the time. I see a new doctor. He might say, is it this? Is it this? Go back to neuro, go back to them. But sometimes pulling back, as long as it's medically safe to do so, sometimes gives you more control, and you feel mentally better because you've brought yourself out of that whole cycle of chase.
Yeah.
But, I mean, really, what we need is to be giving people also tips. You know, one of my big tips is it's all written down before I go in. I've got my questions. Here's my list of symptoms, my meds. And if he doesn't listen, I push, or him, her, how sexist. I push the piece of paper in front of said doctor and say, read that and answer those, please. Because otherwise you go, it's like like revolving door. You go in, you get spat out, and you're like, oh, no, I didn't say that. Tips. What we really need is tips here for people to take back control of their health.
Well, I think.
I'm quite lucky. I studied to be a medical social worker long before I was Mick Scarlett's TV and media star. I wanted to be basically Grace. I wanted to be disabled, working in Royal National Orthopaedic. Actually, that was my goal. That's where I went. I know that's where Grace went as well. And I wanted to work there as the social worker, because I had such appalling social work when I was 15. I cannot explain it. But anyway, so I studied that. So I was studying a nursing exam, like a qualification in nursing, and the social work exam, because I wanted to do the both. But unfortunately, Margaret Thatcher cut the social work numbers down, so I couldn't do that job. So I went and became a pop star and a TV celebrity instead. But I had a lot of knowledge. And my top tip is get knowledge, folks. So here is my neuroanatomy book that I bought, that is actually a medical book, like an actual textbook for nurses and doctors who are studying. I have a collection of them. So every single thing that's wrong with me, I know all about.
Doctors are going to call you a hypochondriac. You know, this is the problem, isn't it?
I had a gastroenterologist who used to insist, she used to ring me up and talk to me in Latin. And it got to be a competition because I knew enough about my condition and what the medical terms were to be able to talk back. So I'll never forget, one day she rang me up and she spoke almost entirely in Latin, and I was on my laptop while we were talking, and I was typing in what she was saying. So by the time it was my turn to reply, I knew what she was talking about, because by this time it was way above my, head. And in the end, she insisted that I went to another doctor, because apparently I wasn't following her advice, and it was like, no, I want to. It's just I want to make sure that it's the advice that works. But I really think knowledge is it. No. For those of you like myself and like Grace, that have a diagnosis that we can follow, get knowledge so that you can talk knowledgeably. I mean, I can't imagine how wonderful it must be to be Grace to go in and go, well, as a practicing doctor myself, because then they'll immediately go, well, I can talk to you like an equal, and we have to fight for that. So
even really the stuffy old chap in his tweed coat, I doubt it.
And the other one I think, of course, is that it's changing over time. Like when I was young, you didn't, everyone just talked over your head all the while. It really was like, you were just this piece of meat that they were going to muck about with until they either broke it or fixed it. But now younger people are coming up, they're in the society, they see equality, they understand better. And I think that's a really important thing to remember is, old gits like me that moan, rubbish, and they got everything wrong. We're talking about, don't forget, I'm talking about 1965 when I was born. My spine collapsed in 1981. So I'm talking a long time ago. Royal National Orthopaedic had a children's ward back then called Zachary Merton Ward. It's now a shambolic wreck of a building that's got no one in it. So it's so long ago that things were completely different. And I think that's one of the things to remember. A lot of the doctors I see now are brilliant. And it's just that, like any human being, we always talk about the bad stuff. We don't tend to talk about the good stuff. And I find that when you get someone that cocks it up, they tend to be old, and they also tend to be quite high up. So they've kind of promoted themselves into a position where they're not allowed to get things wrong.
I think that's absolutely right. The few that have been actually quite terrible and cold as the Sith Lord have been the ones that are generally about reaching retirement age or have a hyphenated name or something like that, or got something stuck in their throat and speak of the results.
And it must be hard for them because years ago we were all ignorant. Now we've all got the internet.
I know, but these are the few that the old guard who are leaving the service. I think as we are supposedly becoming a more inclusive society, I think the junior doctors coming through are seeing that. They're a bit more open-minded to people, to children and stuff, like to disabilities, and they're learning as they're seeing more people come in, because the number of disabilities is driving. With long COVID as well, there's causing much more disability in society as people are not recovering. So they're seeing more of it, and they're learning more of it. They're learning how to speak. But I will say with Emily, there's always, like I said, that one-to-one dialogue with her. With the operations now, if we go in, they will speak to her. If it's an operation that's, as we call it, like a vanity operation, if she wants to have her legs straightened and stuff, that's her decision. She'll be in charge of that conversation. They will speak to her about
being
it.
tested.
If she doesn't want to do it, she won't do it. But it's just the biggest tip I would say is, as a parent, is we had to push to make sure we were listened to originally way back in the past. And now across the notes, it's just listen to parent written across the note, because no one knows a child better than a parent.
Wow.
Yeah, absolutely. No one knows a child better. And we find that happens all the time now, but I just wish they go back to those notes every so often, so I don't have to keep repeating the list of medication she takes every time I go in. So now I'll just give it to Emily to say Mervacol, suppository, yada 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 yada. I just wish they would get that list.
Don't you think that's one of the weird things that we all share, is that we go in every time, and even with someone that knows you, they go, so what was it again?
What you on?
And then you get the different notes from every different person you see, and you, even though you sold the same story, they've written it down different. Yeah. So you're like, no, I was born with cancer. I didn't have cancer at 15, and it's like, did you not listen? It's like, it should be on the computer. It's not like in the old days where you carried a pile of paper with you that they lost all the while. They're all connected now by this thing that we're using. So kind of it amazes me that you're like, why am I telling you all this again? You must be able, I know you've got not much time, but please. Really?
No, that's not the downside. There's no Emily's talking, obviously, that we can't get away with the fact that saying, yes, she has a lot of morphine. Can we take a lot of morphine home, please? Is that okay? Yeah, just give us all the morphine in the hospital you can. I'd like to take that home.
Yes.
I mean,
This doesn't happen anymore.
you know, we
that's
get
me
a
and
10-minute
Zec.
appointment. I've got a straw in my Oromorph. You know, we get how long do we get? 10, 15 minutes, unless you really are confident and you sit there and you're like, no, I'm not moving. And they're in there, right, what has happened? And you're like, wow, you know, I want to talk about now, and yet I've got it's like starting a journey again every single time, because you do the registrars, I remembered that word, the registrars rotate, and so by the time you go back, and I always get the come and see me in 6 months, which means I'm just going to see someone new every time. I mean, I've got an open appointment, but I think they just said that to get rid of me. So Grace, come on, we need these big tips. We need this advice that you're going to give us for dealing with these doctors to get the best out of our appointments and the best for our care.
Yeah, the inside track.
I think it's coming from me as a patient more. I think my big advice would be to really learn to advocate for yourself. And I think I've only really learned to do that in the past 8 months effectively, and be really clear. And it might take a while to actually decide what your needs are. But if you are very clear with your needs, that's really, really helpful. And I think one thing is, if you feel uncomfortable, absolutely say, and like, I think paternalism still prevails, unfortunately, in medicine. So it can be really hard when a doctor is telling you, like, for example, I was at an rheumatology appointment the other day, and she was saying, oh, okay, you need to be on tablets for your bone density, so we can put you on these. There's an injection, but you should be on the tablets. I think it'd be better for you. And I was like, oh, okay. And then I was thinking in my head, I thought, actually, no, that doesn't fit with my lifestyle to have a tablet every week. I'm not going to do that. I'd rather the injections. And so then I was like, actually, no, sorry. Can I just, I'd rather this because, you know, this. And of course she was like, that's fine, you know, but if you don't say, and it can be really difficult too, especially when you've got some specialist or a senior consultant and they're telling you what you think, you know, but I think the main thing to remember is that this is your life. You know your body better than anyone else. So really be confident in your decisions. And if you feel uncomfortable, absolutely say, because no one wants to do anything that makes you uncomfortable, but it can be hard when you feel like you're pushed down a route that you actually don't want to go down. But
I suppose they've got us, that they've been to university, doctors, college, stuff like that. So they have a specific route they want to go down for you, where they're actually thinking that you've got an alternative route. So they're coming from that medical point of view that I should be doing this and subscribing this and offering you this, where they don't actually think that you may be vying for a different alternative. So I can sort of like see the two juxtapositions there, where they come from and where you come from. But it's really good when you meet in the middle and they actually just said, they will go, oh, yeah,
get that
okay,
relationship.
if that's what you prefer, then, if that's what you prefer, then we'll go down that route. So I think that's really, really refreshing.
I mean, can we actually say, we say, no, I want to see X doctor because I've seen him before. I don't want to go over it again. How can we actually say to a doctor, great, you know, a registrar, look, I'm really sorry, I don't want to be rude, but I don't want to see you. Or is it tough?
Yeah, that's not rude at all. I think it's tough in the sense, I think, especially at the moment, the NHS is so burdened that I think it can mean, the issue with that can mean that you then might get an appointment months later. So it's difficult to weigh up. Yeah. But I mean, it's obviously really important. And I think it's still important to say, you know, even if it could be possible, you never know. So I think it's really important to say exactly what you need. And see, because I know it's really frustrating to have to explain again and again what your whole history is. You're not there for that. I know it feels like very precious time. If you've been waiting for an appointment for 5 months, you don't really want to start again with your history. So it can be really, really difficult. And I think,
I mean, imagine it's 40 years this year since my spinal cord injury, and it's now it used to be the hey, what happened to you question, but you were like, oh, here we go. But actually now it's when you go to a doctor and they go, so why are you in that?
Otherwise, and, on the floor.
And you can't help it. Your little devil comes in and you think, well, what story can I make up today? I was actually hunting sharks. And then you think, no, this is not the place to do that. You've got to be exact, because otherwise, like I said, they'll come up with some story. Like what I was going to say is the other ring. I mean, I don't advise everyone to try and read books this detailed, because they are it's very detailed, it's very scientific, and it's quite full of quite gory pictures too. So if you're of a weak disposition, avoid it. But it does teach you that actually what's taught in textbooks isn't always correct. Like, I know that what my body should be doing from the level of break I have, T12, L1, L2, I should have a lot less function than I do. So when I go in, one of the things I always make sure to tell anyone is, oh, it wasn't incomplete. It's not a crush, not a break. So I actually have, and then I list some of the things that do work that shouldn't. And that's really helpful. So another tip is, like Grace said, know your own body, know your own thing. If you're going in with something new, say, I'm not sure this is to do with the other stuff I've seen you about, because, you know, it might be, but I'm not sure. Because then at least they'll start looking at stuff, but also go in with your greatest fear. Because I had cancer as a baby, I'm always on the lookout for a possible new cancer. So I go in and I go, well, you know, I had cancer when I was a baby. Could this be? And immediately I'm sent off for, you know, MRIs and that. And then they go, no, you're lucky. It's not cancer. It's something else. But I know what I want to be done first. So I think that's really important. Don't be afraid. Don't be shy. Don't think, oh, and also have no shame. Right?
No,
if you're going in to talk about stuff that's wrong with your bum or your bits or your bladder or what, just go in and be completely open. I'm very lucky. I very early on developed a thing of being able to totally disconnect. I'm able to disconnect my brain completely. So someone can be doing all manner of unquestionable things to me, and I'm not there. So you've got to be
back to mixed youth.
Yes, back to my bedroom. We won't go into that, but do you know what I mean? And I think that is really important, because you can get hung up on, oh, I don't want them to look at that, and I don't know. Yeah. And it's like, no. It's much more important to be alive than to be modest.
Yes.
So
I mean,
just go
I
there.
have to hold my hands up at this point. I've had issues since during lockdown, probably last June, where I know that I'm having issues that it could be. I get this confused. Prostate, one's laying on the ground and one's up my bum, but it's one of them. And I know I'm getting issues with the urine flow and everything, and I should see a GP.
Can I just say that something that doesn't get talked about very much is if you sit down for a long time, it can cause scar tissue in your urethra. I know this because I had the surgery done. And so you feel like you've got a prostate problem, and you don't. You've actually got, because you and me, Zec, we're quite heavy guys. We sit on our bum. Our bum isn't that developed. It gets a bit squishy. So basically it can cause problems. So there's, folks, a little bit of detailed information about my own biology. But
I Googled it and it said I was going to die.
I had that fixed, mate. And I tell you what, it's scary, because suddenly you feel like a powerful horse. So when you go your doctor and just say, I need to see a urologist. And then that's it. Bang. Done.
She'll say you're taking the piss.
And she will. And I tell you what, I was terrified of having that done, because no one likes surgery down there. And I kind of went to sleep and it was like, ooh. And I woke up and it was like, oh. And then a week later, it was like, oh my God, this is amazing. I didn't realize that you could actually go to the toilet like that. And again, that was because people thought, oh, well, he's paralyzed, so he won't be able to control his bladder.
Yes, exactly.
So it wasn't looked at. So again, it's knowing what it's knowing what you can do. So get down to doctors.
Not more.
Yeah.
But that's it's keeping inside you, mate. You're filling up like a little balloon swilling around. Get it all out. Anyway, that's enough. That's enough of personal medical details. So this is it. See, there you go, Grace. I could have been a doctor. Hello and welcome to Dr. Mick's medical half hour.
So much information. I love it, Mick. And I think you actually make a really important point before that as well, because I think what's really helpful for doctors, if you go in and you spell out your number one priority, your number one concern first, because a lot of the time, if that's not communicated, your doctor's going to think it's something completely different, because they might have kind of no idea how you live your life and what is a priority for you, what's important. So I think that's actually really important to get that straight at the beginning, so then there's no miscommunication down the line.
Absolutely.
Yeah, don't think of that, do you? Going in and say, look, I'm really scared about this. I've got a couple of hang on, I'm trying to juggle here. I've got a couple of things. We had Tina who sent in, she's got a horror story from a doctor. A new neurologist ordered an annual review for her epilepsy medication and said, no, you need to increase it. And she's saying, well, no, it's worked for 17 years.
Yeah.
And she ended up in A&E.
Yeah.
Really? Because
my wife's dad was profoundly epileptic, and he had this all the while. They would be giving him 2 or 3 of the same pills with different names. So he'd be massively overdosed. And, he fainted on a tube track. he fell over on a zebra crossing. You know, he's been hit by buses and all. You know, I mean, he sadly died recently, but really he had all of that, and that was again because he was far too kind of. He'd go to see a doctor and it'd be like, oh well, they know best. That they're going to try and fix me, and he would let them do anything. So they'd say, oh, we've got this new drug, we'd like to try it, and rather than say, well, hang on, it's the same drug as the other drug, but it's a different formula, they'd give him both, and he'd just go, yeah. So
well, that's basically that's what happened with me. You know, in pain clinic, I was on buprenorphine, and I was on the highest dose of buprenorphine, and this crusty old consultant said, I'm going to switch you to fentanyl because even though they work the same, you will know your body will react differently and it may work. And so I was on a 54 or 52 dose at the time. So he gave me a like for like dose. He said, I'm going to put you on 50 plus of fentanyl. And I thought to myself, hang on, I thought fentanyl was twice as strong. But he was the consultant, so I went with it. And then I was in A&E, unable to breathe. I was really struggling. I hadn't clicked. This is it. No. Yeah. But, you know, you're right. We do trust them. And so they go, right, here's a prescription, take that. And we're like, oh, thank you. So very grateful.
No, you're right. And it's going to be interesting from Emily's point of view when she hits adulthood and she makes that transition for pediatric, how she will be judged and how they will speak to her and how they will talk about medication to her. That's going to be a very interesting aspect. Obviously, that's not going to happen for a while, but I'm hoping that the care and the progress and the intelligence from the pediatric team will at that point enhanced into further on down the line with the further medication as society hopefully progresses with inclusion and stuff like that, and talking about disability, and more disabled GPs and people are going through into medical school and coming out. So I'm hoping there'll be a bit of a sea change by that time that happens. I mean, we've got brilliant people like Grace coming through, and obviously Hannah Barnum Brown coming through, and more people coming in who are suddenly thinking, look, I'm in a wheelchair, I can be a doctor, I can do whatever I want to do. And yes, you can, you absolutely can. So fingers crossed. But obviously we can't have this DHTV till about another 5 years time, when unfortunately,
of course we can. By that time we'll have our own channel. I'll be on all day. We'll be all day, all the while, just non-stop us waffling like this. 45 minutes, they'll look on that as a dream time when they could turn it off and watch the football.
I just want to say, Tina did email me a couple of her stories, as did Nigel. What I'm going to do, because it's so difficult to get these stories out online, and I very briefly skipped over it, I'm going to picture post to Disability Horizons TV to talk about this more, put some tips on there, whether it be one of their writers or myself, because you know, there's a lot to go in. It's very difficult to, you know, when you're reading out something long online, my draining on voice, it's really quite painful, would require its own set of meds. So we are coming up on time. We may even finish dead on time tonight.
No.
So
I was going to say, we've got 47 seconds till the alarm clock goes off.
Look at that.
That's like professional time. We finally reached that point where we look like we know what we're doing.
I don't know about that.
I don't know about that.
Yeah.
Part of our joy, and it's part of our charm.
So before we go, and I know we've done this before, but Mick did this last week with tips. We can do one tip. If you're going in, you've got an appointment, you're going to see a consultant, we're going to have one tip.
Oh, from me. I would say be
Mick.
Positive. And yes, Mick, thank you.
That's you. Comes up. That's you.
That's you, darling. That's your cue.
Yeah.
Be positive, be confident. And I'm going to stop the alarm, so I'm going to go off while I'm talking, and I don't want that. So be confident, and also, like Grace said, that thing of know what your top issue, and Zec said, know your top thing that you're going in for, because we do tend to save it up, and we'll go in and go, oh, by the way, and then there's this bit, and is that bit related? And oh, what about this? And can I have some more of that? So go in there with your top one, but don't let them fob you off. You know, if they go, oh, well, there's nothing we can do about that, say, well, can I see someone else? Can we take it up? Can I see a specialist? Can I see? Because, you know, I've had to do that in my life, and I wouldn't have been here if I didn't. So it can be life-saving, or it can just improve your quality of life. But always know that it's important. So don't put it off. Get in there. Get seen.
Yeah. Dan, come on, a tip. Give us a tip as a parent and also as a patient.
Oh, as a patient,
for both.
That's a tricky thing with mental health, because
always
ended up going to the doctors when I'm in a really low mood, and of course, when you're in a really low mood, you can't really have any conversations. So that's quite a tricky one.
Do you think they take us less seriously with mental health as well?
Possibly, but obviously, as a carer as well, and someone who relies on me 24/7, I think they just obviously need to up the ante a little bit with us, because it's prevalent in the care community anyway. But speaking from a parent point of view, I'd always say make sure your voice is heard and engage your children in the conversation. Let your children have, if they're if they're verbal, let them be part of that conversation, because as they get older, these things will fall into their lap. So they need to be aware. So engage them in the conversation, and with the doctors, make sure they talk to them and don't talk over them.
So don't do what the doctors do. Basically, you'd be just as involved in your children as doctors should be.
It's their lives, and regardless of, they need to be involved. Because like I said, Emily is now getting to the age where she will make the decisions whether she wants this leg stretched or anything. If it's a non-emergency, that's down to her now. It's down to her.
And Grace, we want an insider tip, like a secret, like you game cheat. One of these.
Is there a handshake? Is there a doctor handshake we can do that indicates that we are part of the gang? We get the special treatment.
And are you free next Tuesday at 3? Because I've got a problem.
I couldn't possibly tell you the secret handshake. I'm sorry, guys. I'm just probably going to reiterate what you guys have said, but definitely be really confident and clear in your needs, and you know your body. I think listen to it when you think something's wrong or you're in pain. I think definitely it's really hard. I say this and make it sound easy, but it's really hard when you're a patient to try and advocate for yourself. But I think, being really clear in your needs and what is a priority for you that needs to be fixed. I think,
Brilliant. Thank you, Grace.
I mean, that's great. Thank you so much, Grace, for coming on here, and we wish you all the best with your career. I mean,
absolutely.
We're going to come back in 20 years and see if you're just as keen.
All I know is I want Grace to give up paediatrics and go into spinal cord injury at Stanmore, because I know someone that will be at the front of the queue going, see me.
No. She's got to come to Southampton General. That's where it's at. That's where the hip doctors go. Not the hip doctors.
Of course, the only problem is the last thing you want to be is a wheelchair user at the Royal National Orthopaedic, because it's just a great big hill, isn't it?
Oh my God!
I've been offered to
they built a hospital for people that can't walk, and they put it on a hill just to keep you in your room. You're not going anywhere, mate.
So is that the one that's flat all the way in? It's flat all the way in. It literally is flat all the way in.
Oh yeah.
And they've got 3 Costas.
3?
Yeah, 3 Costas.
Wow.
They've all got Costas now. Southend sold out and gave their foyer to Costa Coffee. And so when you're wheeled through for surgery, you go through the foyer with everyone.
Grab one on your way.
Yeah, that's something else I want to say. We're going in for a sleep study in 2 weeks. Me and Emily are going for a sleep study on the Sunday night, where basically we go in and we just go to sleep, where she has a BiPAP on to measure the levels. Yeah. And we're always stuck in a ward, funnily enough, with no one else in it. No one else in it at all. And the Costas is right outside. So I am really looking forward to this hospital appointment.
Really, but it will ruin your sleep study as you're awake, vibrating after the 12th cough. You don't sleep at all, then, Dan? No, that's it. Have you noticed that our waffle at the end has completely killed Zec's brilliant timing of the program? We've overrun by 2.5 minutes.
Yeah. What national anthem?
Good luck to those of you that are following the football. Mick and I are both going to switch it on and go to sleep. But I know many of you out there are excited.
Yeah. Have fun.
But please don't let it be an excuse that you end up in A&E and needing the help of a doctor just because your team won or lost. And that is that. I'm going to press the button now, end broadcast, and then we're all going to talk about you and your comments.
Thanks, everyone. Bye.
Take care. Bye.